Coughing, wheezing, chest pains are all signs of a respiratory illness. The ailment is reportedly on the rise in Saint Lucia. The spike, which is allegedly having a considerable impact on the particularly vulnerable education sector, is being actively monitored. That's according to a statement from the Ministry of Health and Wellness.
Over the last few weeks, parents note that children seem to be developing recurrent respiratory infections. Most of the cases are mild in nature. This trend is anticipated as the measures that were placed during the management of COVID-19 also reduced the regular influenza cases over the last 3 years. Our population is now exposed to many different strains of influenza virus at this point.
The Ministry of Health notes that the increase in respiratory illnesses has impacted a wide range of age groups. Chief Medical Officer Dr. Sharon Belmar-George says that over the last 30 days, from January 8th to February 6th, Saint Lucia recorded 178 cases of COVID-19 and 1 COVID-19 death, with the 25 to 49 age group most affected. The highest incidence of cases was noted in Grosley and Babono.
These numbers are low due to reduced testing in country. Hospital admissions for COVID-19 remained below 5 cases daily for the last month. The Ministry of Health is closely monitoring the emergence of new variants and subvariants of COVID-19. At present, we have sequenced about 12 subvariants of Omicron circulating in country. In addition to COVID-19, there are other respiratory viruses in circulation which may possess similar clinical presentation to COVID-19. In several countries, there's been a steep increase in influenza and respiratory syncytial virus.
Dr. Belmar-George offers advice on how to lessen the effects of respiratory conditions. She advises eating a healthy diet rich in fruits, vegetables, and consuming water, as well as maintaining sanitary conditions at home and at school, making sure surfaces are cleaned and disinfected regularly, and adhering to proper cough etiquette.
Persons who are symptomatic should be managed based on their symptoms with Panadol, cough syrup, increased fluids, and rest. If your condition worsens, visit the nearest wellness center or your private health facility. Children who are exhibiting active infection should be kept at home until they recover. Ensure face mask use if they interact with others. The influenza and COVID-19 vaccines are available at all of the wellness centers, and especially high-risk patients are advised to get them.
In relation to COVID-19 globally, nearly 10.5 million new cases and over 90,000 deaths were reported in the last 28 days, 9th January to 5th February 2023, a decrease of 89% and 8% respectively compared to the previous 28 days. At the regional level, in the last 4 weeks leading up to February 6, 2023, the number of lab-confirmed cases has remained relatively low in CARPHA member states. The Ministry of Health and Wellness says it will continue to monitor the situation and provide guidance as required. Solange Alfred, HCS News Force.